7 will focus on carcinogens and their role in the cancer development. Understanding genetic factors in cancer, substances known as carcinogens are recognized as being able to trigger cancer, of course. So mutations in the cell's DNA are responsible for driving the abnormal growth processes that have the potential to progress into cancerous tumors. So the likelihood of developing cancer among those exposed to carcinogens varies due to different factors. So these may include the amount of time that one spends and the level of exposure, along with an individual's genetic traits, of course. So some of the carcinogens we have include the tobacco smoke. So these are much common, especially in Kenya. The occurrence of several forms of cancer, including the lung cancer, the throat cancer, the mouth cancer, and the esophageal cancers, can also be largely attributed to smoking. We also have secondhand smoke that can also increase the cancer risk, of course. Like here we have person smoking. Another factor is asbestos, these minerals fibers, which are normally occurring naturally. So they found widespread application in construction materials. So being exposed to asbestos can also raise the chance of one developing lung cancer and mesothelioma. So we have to be very careful with the asbestos, especially the roofs that normally have got asbestos. So another area is radon, which I'm keenly taking research in. So you'll find that particularly in some of the confined areas like the basement and the crawl spaces, they normally have got the accumulation of this naturally occurring radioactive gas. Remember, this one results from alpha decay series, and this gas has got higher linear energy transfer, which is when deposited in our lungs can lead to what is called a lung cancer. So lung cancer is commonly caused by radon exposure in people who do not smoke. There is radon, and then we have chemicals and substances which has been found to the use of certain chemicals in manufacturing industries can also elevate the risk of cancer. So examples include the benzene, specific types of polychlorinated biphenyls, that is the PCBs, designated dioxins, and also particular pesticides which normally use. So under radiation, we can also say that the risk of cancer development can be increased by exposure to both ionizing radiation, like the X-rays and the radon. Now that most of us are so much prone to undertaking X-rays, so before getting exposed, you have to ensure that the benefits normally outweigh the risk, because too much exposure to X-ray may also lead to uncontacting cancer. Remember, it is the same X-rays that we normally use in treatment of cancer. So when it comes to treatment, we normally use the megavoltage X-rays, but when it comes to diagnosis, we do the kilovolts. So nano-ionizing sources like the sunlight or the tanning bed can also result into cancer. Otherwise, thank you for attending the lecture for today. So I hope you'll also enjoy our next lecture, which will be lecture 8. Thank you so much.